Pradeep Pendyala, Professor of Anesthesiology. Today I am going to talk to you about one very important surgery, TURP, transurethral resection of prostate, and anesthetic implications, right? Various irrigation fluids have been used for irrigation during TURP. You are well aware, glycine, sorbitol, mannitol, and also sometimes normal saline. Well, very few people know that glycine can cause echocardiogram changes and also ECG changes lasting for more than 24 hours. Will you believe that? There will be increased troponin also after glycine usage. There could be T-wave depression or inversion. So these are the things which must be known when you are using glycine. I'm sure you would know that benign prostate hypertrophy is the most common benign tumor of prostate gland, and TURP is the treatment of choice. If only the prostate is weighing less than 60 grams. That's very important, friends. You must know that. And while using irrigating fluids, there could be few changes in the central nervous system, and they are mainly due to acute changes in osmolality. On an average, 10 to 30 ml of irrigation fluid is absorbed per minute of resection time. So make sure the resection time is kept to the minimum. And increasing the height of the irrigating fluid can cause the problem too. So make sure that the increasing height is avoided, and avoid hypovolemia, hypotension also, and make sure that there is no fluid overload by fluid excessive absorption. Glycine toxicity leads to headache, nausea, and malaise. Interestingly, glycine potentiates NMDA. Do you know that? NMDA is potentiated by glycine, which can precipitate encephalopathy and seizure. And the treatment is always depending on the hyponatremia. When the sodium level are less than 120 milliequivalent per liter, it can be managed by loop diuretics like furosemide. Okay, and when the level of hyponatremia is still less than 120 milliequivalent per liter. Initially, what I said was when the degree of hyponatremia is more than 120 milliequivalent per liter, that time you can use loop diuretics like furosemide. When it is less than 120 milliequivalent per liter, you have to give 3% sodium chloride. And correction should be very careful. You should not exceed 100 ml per hour. Okay, when you are giving 3% sodium chloride. If you give more than that, and if you exceed 0.5 milliequivalent per liter per ml per hour of 3% sodium chloride, if you exceed 0.5 milliequivalent per ml per hour, it can cause cerebral edema and central pontine myelinolysis. So that you should be very careful about when you are doing. The ideal irrigation fluid for TURP should be electrically inert, isotonic, non-toxic, non-hemolytic, transparent, non-expensive, and easily sterilizable. There is no such ideal irrigation solution till today. Okay, and distilled water is electrically inert, inexpensive, but it should not be used because it can cause systemic circulation, and when absorbed into systemic circulation in large amounts, it causes hemolysis, shock, and renal failure. Don't use distilled water, though it fits the criteria. Isotonic irrigation solution like normal saline and ringalactate are electrolyte solutions that can conduct electrical currents, especially with monopolar cautery. Hence, it should not be used. However, if you are using bipolar cautery or laser TURP, it can be used. Okay, commonly used solution I have already mentioned: glycine, mannitol, sorbitol, cytal, sometimes urea also 1%. To preserve the transparency, these solutions are purposefully kept hypotonic. That's the reason. Glycine can cause retinal and cardiac toxicity too. Visual disturbances such as blurred vision have been reported and transient blindness too. So you have to be very careful when you are using glycine. Well, you must know visceral pain sensation from the bladder, neck and prostate gland is carried by afferent parasympathetic nerve fibers which arise from mainly second and third sacral nerve roots. Okay, which travel with the pelvic splanchnic nerves, and bladder sensation is carried by sympathetic fibers of the hypogastric plexus, which are derived from nerve roots T11 to L2. Hence, sensory level of T10, regional anesthesia, when you are giving a block, spinal, sensory level of T10 has to be achieved, dermatomal level anesthesia. And that is required to eliminate the discomfort caused by the bladder distension and other aspects of TURP. However, sensory level above T9 should not be sought. Why? Because it could elicit no pain when perforation occurs of the bladder or prostatic capsule. That's very, very dangerous. So try to attain sensory level of T10 and not above T10, because when the capsular perforation takes place, prostatic capsule perforation, pain would not be sensed by the conscious patient. Okay, the signs and symptoms of fluid overload can be sensed easily under spinal. Water intoxication are recognized early and easily by the patient, and he can complain of shoulder pain or abdominal pain when the level of blockade is limited to T10, not about T10. Don't try to reach T9, okay? Subarachnoid anesthesia would provide dense local block compared to epidural anesthesia. Hence, spinal is much more preferred over epidural. Caudal and sacral blocks also have been effectively used in prostatic surgery, especially when there is a high-risk patient. But you have to make sure distension of the bladder is avoided by constant irrigation of the bladder. Otherwise, patient would have pain under caudal and spinal blockade. Okay, even you can do under saddle block, when the patient is very sick and high risk patient, when even spinal is contraindicated in such patients. Okay, now bipolar TURP has an advantage over monopolar. By bipolar trial electrode, it allows normal saline to be used as irrigating solution, which avoid morbidity associated with hypoosmolar irrigants like glycine. That you should be knowing very well. Okay, and problems associated by the use of irrigating solution, you must know. To maintain visibility during surgical procedure, continuous irrigation of the bladder and prostatic urethra is maintained, which also distance the site of surgery and help to remove the dissected tissues, debris and blood. So absorption of hypotonic irrigating solution into systemic circulation can cause TURP syndrome. Okay, and normal saline cannot be used as irrigation solution because it conducts electricity. I hope a brief introduction of TURP syndrome and its anesthetic management and anesthetic implication were well understood by you. Thanks for patient listening. Have a wonderful, happy and relaxing weekend. I'm signing off for right now. Until next time, take care. Bye-bye.